Hi, my name is Crystal Lyle, and my patient AD is a 53-year-old Caucasian female who presents to the clinic for a complaint of a rash. The patient states the rash has started 3 days ago. It is dry. It is slightly itchy. It is located on her right posterior thigh, her right forearm, and underneath her left eye. She states she's not changed any products, hasn't changed her laundry soap, hasn't come in contact with any poisonous plants. She hasn't been hiking. She works as a librarian. She hasn't tried any new foods. She denies chills, denies fever, denies joint pain, states that she hasn't removed any ticks or any bugs, does not have any pets. She's a non-smoker, non-drinker. She doesn't take any illicit drugs. Her vital signs are 134/78, 80, and 20. Her temp is 97.4 with a pulse ox of 98%. She is 5 feet 4 inches tall, and her current weight is 162 pounds. That would give her a BMI of 27.8. She has no past medical history that's significant at all. She has had no surgeries. She's married. She has no children. She's had no pregnancies. Last menstrual period was a month ago. She's not sure of the date. She exercises regularly, attends a local gym. Her diet has been healthy. She tries to eat a low sodium, low fat diet, and she doesn't smoke. On inspection of the rash, it is flat. It is red. The rash on her thigh is circular in nature with a darker center. The rashy area on her right forearm is also red, but there's no distinct shape to the rash at all. That one is slightly warm and a little bit edematous. The rash underneath her left eye is just very small, maybe 1 centimeter by 3 centimeters. It's oval shaped and it's consistently one color. There's no drainage from any of the rash. It is dry. It's not painful. She hasn't tried anything at all to improve the state of the rash, and she says nothing makes the rash worse. For differential diagnoses, I picked atopic dermatitis. The rash is generally red, dry, patchy areas that can be itchy. Usually this is caused by an environmental trigger or stress, and there's generally a family history. It can also be caused by an overactive immune system. The patient has no family history of rashes at all, and no family history of asthma. She's had no contact with any new products, so this is most likely not the diagnosis. My second differential diagnosis was cellulitis, especially with the appearance of that right forearm. It is red, it is slightly warm to the touch. It does look a little irritated, but it doesn't seem to be extending and increasing in size according to the patient. My third differential diagnosis is an allergic reaction. Generally that rash is itchy, it's disseminated throughout the body, very generalized. But again, this isn't very likely since the patient hasn't had anything new introduced. For a diagnosis, her rash appears to be disseminated Lyme disease. For treatment, it's better to treat the Lyme, especially with that particular rash, because blood work can take up to 6 weeks before it shows any Lyme titers. So for treatment, doxycycline, 100 milligrams twice a day for 14 days. An antihistamine was also recommended daily for the itch. The patient said that it was more bothersome at bedtime, so I suggested that she take the antihistamine at bedtime, maybe a 25 milligrams of Benadryl